We asked them to take off their own organizational hat and look at the healthcare workforce issue from a wider lens. That was something that I really didn't think in the beginning was going to happen. We asked them to think strategically and collaboratively, and they took that to heart. Staff from our healthcare and education institutions, they worked over 6 months to create this collaboration, and leaders from these institutions, they pledged their support. What this group has put together focuses on a system-wide recruitment and retainment of healthcare students. Many of these organizations have various strategies to recruit new students, but this is unique in that it will provide an opportunity to collaboratively recruit new students, place them in an appropriate education track, and finally, giving them the best opportunity. We hope that this will help us solve our healthcare workforce shortage and will become a model for other communities to look at. We knew that this problem was too large to solve alone, so thank you to everyone being here today for finding a way to solve it. Polk County is more than proud to make this $1 million grant, and we can't wait to see what this collaboration grows into. I hope that we can look back in 10 years and say that this was one good thing to come from COVID, because it really wasn't much, and have a strong collaborative healthcare network that is focused on an overall health of our community.
Continues to be in front of us, and so we're much stronger together. In fact, the essence of this community is around partnerships. So thank you to you and the other supervisors for making this possible. We're super excited about this partnership, and I stand here on behalf of these healthcare organizations. I'm proud to do so, but they deserve equal, if not more, the credit than I. And the people you mentioned already are the ones who were at the table making this happen. I'm sure it goes without saying that healthcare is no exception, that the availability of people to work in our organizations, both presently and into the future, is a significant challenge. In fact, unlike ever before, it's the greatest I've ever seen in 38 years of healthcare leadership. And I don't think it's going to get better anytime soon. So we have an opportunity. And again, we're not the only industry in this country going through this challenge. This collaboration is exactly what's needed, this new partnership fusing together between education and healthcare with the support of the county. I can't think of a better solution to approach this challenge. And we will be fine. We all find a way to the next day. We all find a way to support our missions. It just so happens our mission is really special because we take care of people at the time of need, whether we're educating professionals to take care of people, whether we have the delivery systems to help take care of people. Our communities, our state, certainly our county, they rely on us, and we need to be here for them. So we're very excited about facing this challenge together. We know this partnership can't stand on its own, and we know it's not a partnership or a collaboration of success without life. And we assess the whole situation together collaboratively and identify the need for liaisons or navigators to really tie these relationships together in a meaningful way at the primary, secondary, and post-secondary education level, together with our healthcare organizations. They'll help youngsters entering the field, whether it's going into healthcare or just choosing a career, why healthcare is a special career for them to consider, why it's meaningful to work in this area, and how they together can help make the future brighter for Iowans. So we believe these two collaborators that will work between schools and healthcare, students, community, and then the third position will actually be kind of more of a marketing position to create an understanding and awareness that this program is in place and to help people understand what the education requirements, certification requirements are in order to be successful as a young healthcare professional. You know, our parents, our grandparents, our generation all touch healthcare in some way. And we have an obligation to create the future. And doing it together, I can't think of a better way of doing it. So I want to thank all of you, county leadership, for helping us make this happen, your generosity. I think it's going to go farther than if you spread a little bit across the way because you focused it together. And thank all members of the collaboration, both healthcare organizations and our partnership with education, to really do something different and make sure that we live off the life of collaboration we learned during this pandemic. Thank you for the opportunity to share a few thoughts with you, and again, the opportunity to work together.
And everyone's been scared a little bit because of pandemic. I know we've stressed a lot of our current healthcare providers, and we've made a lot of individuals who are exploring or just trying to decide what to do. They don't know because they really haven't had the exposure and experience. So we're going to show them how much excitement there is and how much value they can get out of that work. So on behalf of the education institutions involved, Polk County Supervisors, thank you so much for what you've done. We look forward to other opportunities to do other grants together, other projects together, again, with the sole goal is to make Polk County one of the best places in the world to live and thrive. So thank you very much.